my seminar today about knee joint. Knee joint is the largest and complex hinge type of synovial joint, made up of two components, the tibiofemoral articulation and the patellofemoral articulation. The tibiofemoral articulation between the condyles of tibia and femur, and it is synovial hinge joint and it is weight-bearing joint. The patellofemoral articulation between the anterior surface of femoral condyle and posterior surface of the patella, and it is synovial plane gliding joint, and it is not weight-bearing joint. This is diagram showing the main component of the knee joint. It is composed of articular bony surface surrounded by hyaline cartilage and surrounded by synovial membrane and articular capsule and intra-articular supra-articular ligaments stabilizing them, and bursae and fat surrounding the bone. The major component, it is bone, ligament, bursae, muscle. This is diagram the major bony articular of the joint, which is consists from the patellofemoral and tibiofemoral joint. This is the anterior surface of the lower distal femur, which is consists from the medial condyle, which is the largest one, and narrowest one, the largest and narrow one, and the lateral condyle, which is connected anteriorly by the surface for the articulation with the patella. And this is the posterior surface of the two condyle connected by deep intercondylar notch. And this is the articular surface for patellofemoral joint. This is the patella, which consists from base, apex, and anterior non-articular surface and posterior surface, which is consists from the lateral articular surface, which is the longest one, and medial articular surface separated by the medial ridge. And this is the trochlear groove on the anterior surface of the femur for the articulation with the patella. This is the upper end of the proximal part of the tibia, which is called the tibial plateau, which is consists from the lateral and medial. The medial, which is the large and oval in shape for the articulation with medial condyle of femur, and the lateral, it is small and circular for the articulation with lateral condyle of femur. Separated in the midline, there is two intercondylar ridge, the medial and lateral, with intercondylar notch. This is X-ray, AB and lateral X-ray demonstrated the bone of the knee joint. This is the medial condyle, lateral condyle, patella, medial tibial plateau and lateral tibial plateau and intercondylar eminence. And this is the patellofemur joint. This is CT scan, which is the best imaging modality for assessment of the bone of the knee joint. This is coronal, sagittal, and axial plane. This is demonstrated the tibiofemoral joint. This is the lateral femoral condyle, medial femoral condyle, intercondylar notch. The lateral tibial plateau, medial tibial plateau, and intercondylar eminence. And this is sagittal view demonstration, the patellofemoral and tibiofemoral joint. This is the axial image demonstrated the patellofemoral joint. This is the lateral articular facet of patella, and this is medial, and this is the medial ridge. And this is the lateral trochlear groove and the medial trochlear groove of the femur surface. This is the medial, the lateral condyle, and this is medial condyle, and this is the intercondylar notch. The ligament. It is consists of two major components, the intracapsular and extracapsular ligament. The extracapsular ligament consists of the ligaments patelli, oblique and arcuate popliteal ligament, and the medial and lateral collateral ligaments. And the intracapsular ligament consists of the anterior cruciate ligament, posterior cruciate ligament, medial menisci, lateral menisci, and transverse ligament. The fibrous capsule attached to the margin of the articular surface. It is partially deficient superiorly, where the joint cavity communicating with the suprapatellar bursae between the quadriceps femoris and femur, and posteriorly, where it is may allow communication with semimembranous and popliteal bursae. The capsule includes the tibial tuberosity, fibular heart, and burst by popliteal tendon posteriorly. This is diagram show the capsule, which is extended along the condyle of the femur and to the tibia and fibula. Patellar ligament and medial and lateral patellar retinaculum. Patellar ligament, which is strong fibrous band, about 8 cm, extended from the patellar apex to the tibial tuberosity. While the medial and lateral tibial retinacula, it is fibrous expansion of vastus medialis and vastus lateralis, comprising of superficial and deep layer. This is medial patellar retinacula and lateral patellar retinacula. This is a proton density axial image at the patellofemoral joint, demonstrated the lateral patellar retinacula by this, the lateral surface, the longest surface of the patella. Therefore, this is the lateral patellar retinacula, and this is the medial patellar retinacula, which is best image for assessment of them. The medial and lateral collateral ligament. The medial collateral ligament is composed of deep fiber related to the meniscotibial and meniscofemoral ligament and to the joint capsule. The superficial fibers form a band from the femoral medial condyle to the medial aspect of the proximal tibia. The lateral collateral ligament complex composed of 3 layers. The outer layer with iliotibial band anteriorly and biceps femoris posteriorly. The middle layer composed formed by cord-like fibular collateral ligament, and the deep layer is formed by popliteal tendon. This is diagram showing the medial collateral ligament extended from the medial condyle of femur to the proximal part of tibia. And this is the lateral collateral extended from the lateral condyle to the fibula. And this is also a diagram demonstrated the major component of medial and lateral collateral ligament. This is the deep layer of medial collateral ligament, and this is the superficial layer of collateral ligament. This is the biceps tendon, which is separated the posterior continuation of lateral tibial ligament, and this is the fibular collateral ligament, which is cord-like, and this is the popliteal tendon, which is the inner layer. This is T1 coronal image demonstrated the medial and lateral ligament. This is the anterior. This is the medial collateral ligament extended from the medial condyle of femur to the upper part of tibia. And this is the anterior iliotibial band, which is continuous posteriorly with biceps femoris tendon to form the outer layer of lateral collateral ligament. And this is the fibular collateral ligament, the middle layer, and this is the inner layer popliteal tendon. The arcuate ligament. It is U-shaped thickening of posterior capsule, which is arise from the fibular styloid and divided into 2 limbs. This is the arcuate ligament, divided to the 2 limbs. The lateral, which is aligned with the capsule near the lateral head of the gastrocnemius, and the medial, which is aligned with oblique popliteal ligament. This is the oblique popliteal ligament. It is a broad, flat ligament of the posterior knee joint, overlying the posterior joint capsule with diagonal course. It is a broad insertion for semimembranous tendon. It is stabilized the posterior aspect of the knee joint. This is the oblique popliteal ligament. The intracapsular ligament. The anterior consists of anterior cruciate ligament, posterior cruciate ligament, the medial menisci, lateral menisci, and transverse ligament. The anterior cruciate ligament arises from the medial part of the anterior intercondylar area of the tibia and pass upward laterally and posteriorly to attach to the posterior part of medial aspect of the lateral femoral condyle. Anterior cruciate ligament resists hyperextension of knee. The posterior cruciate ligament attached to the posterior intercondylar area of the tibia and pass upward medially and anteriorly to attach to the anterior part of lateral aspect of medial femoral condyle. The PCL is stronger than the anterior cruciate ligament and infrequently torn and resists knee hyperflexion. This is diagram showing the anterior cruciate ligament, which is arise from the anterior aspect of intercondylar notch and pass upward laterally and posteriorly to insert on the medial aspect, posterior aspect of medial aspect of lateral condyle. And this is the posterior cruciate ligament, which is arise from the posterior aspect of intercondylar notch and pass upward medially anteriorly to insert on the anterior aspect of the lateral part of medial condyle. This is a proton density coronal image demonstrated the origin of the anterior cruciate ligament from the anterior intercondylar notch. And this is T1 coronal image demonstrated the origin of posterior cruciate ligament, which is arise from the posterior aspect of the intercondylar notch. We demonstrated here intercondylar notch, which is on the posterior aspect of knee. This is both sagittal image proton density of knee joints demonstrated the anterior cruciate ligament arising from the intercondylar notch and inserted on the lateral condyle, on the posterior aspect of the lateral condyle. And this is the posterior cruciate ligament arising from the posterior aspect of the intercondylar notch and arise on the anterior aspect of medial condyle. The menisci. The concavity of the tibial articular surface is partially covered and extenuated by the two semilunar fibrocartilage or menisci, which is distributed the weight-bearing stress through the joint surface, slightly deepen the articular surface of tibia and improve stability. Each is attached peripherally to the tibia and to capsule, and upper and lower surface of menisci are free. The menisci in cross-section is triangular. This is the medial menisci and this is the lateral menisci. Each menisci is consist of the anterior horn, body, and posterior horn. The medial menisci, which is the largest one, less curved and not uniform thickness. With the posterior horn, it is about 14 mm and the anterior horn about 6 mm. While the lateral menisci, which is nearly circular with the uniform thickness about 8 mm. This is the appearance of menisci in the cross section with as triangular. This is the superior surface of it, and this is the inferior, and this is the inner edge, and this is the capsular edge. Meniscal attachment. The menisci, it is attached to the intercondylar notch and to each other by transverse ligament, and the lateral menisci attached to the medial condyle by meniscofemoral ligament. This is diagram showing the attachment of the menisci. This is the ventral surface of the diagram, and this is the dorsal. This is the medial aspect, and this is the lateral aspect. This is the upper tibial plateau. This is the intercondylar notch with the anterior cruciate ligament in the anterior aspect. This is the origin of them, and this is the posterior cruciate ligament. The anterior horn of both condyle, it is attached to the anterior part of intercondylar notch. With the anterior horn of the medial menisci is anterior to the anterior horn of lateral menisci. And the posterior horn of the medial menisci is anterior to posterior cruciate ligaments and posterior to the attachment of the anterior horn of lateral menisci. The attachment of the anterior menisci of the lateral menisci anterior horn, it is closely attached to the anterior cruciate ligament. The anterior horn of both menisci is attached to each other by the transverse ligament. And the posterior horn of lateral menisci is attached to the medial condyle by meniscofemoral ligament, which is divided by the posterior cruciate ligament to anterior ligament of Humphrey and posterior ligament of Forsberg. And this is the sagittal image, which is the best image for demonstration of the menisci. This is a proton density image demonstrated. This is the lateral aspect of the knee by demonstration the fibula. And this is the lateral menisci. This is the body of the lateral menisci. And this is the anterior horn and posterior horn of lateral menisci, which is uniform in thickness and equal in size. And this is the sagittal image of the knee joint. We demonstrated here the vastus medialis muscle and the lateral and the large condyle of the femur. Therefore, this the medial aspect of the knee. Therefore, this is the medial menisci. This is the body of medial menisci, and this is the anterior and posterior horn of medial menisci. We demonstrated here the posterior horn. It is more thick than the anterior horn. And this is coronal image, proton density, demonstrated the attachment of the menisci to the medial and lateral condyle. This is the medial aspect of the knee, the posterior aspect of the knee. This is the medial and this is the lateral. The medial menisci, it is closely attached to the medial collateral ligament, while the lateral menisci separated from lateral collateral ligament by popliteal tendon. This is several fast saturation MRI image demonstrated the attachment of the root attachment of menisci. This is the anterior aspect of the menisci, and this is the posterior by demonstrating the intercondylar notch. This is the vastus medialis, and this is lateralis. Therefore, this is the medial aspect. This is the anterior horn attachment of the medial menisci. And this is the anterior horn attachment of lateral menisci. And this is the posterior root attachment of both medial and lateral menisci. This is sagittal T1 image demonstrated the meniscofemoral ligament, which is arises from the lateral posterior horn of lateral menisci to the medial condyle, and divided by posterior cruciate ligament to the anterior meniscofemoral ligament of Humphrey and posterior meniscofemoral ligament of Wurzburg. And this is axial proton density fast saturation image demonstrated the medial menisci, which is the largest, and the lateral menisci. And this is the anterior horn of medial, and this is of medial menisci. And this is the transverse ligament, which is attached from behind the anterior horn of posterior menisci to the anterior horn of lateral menisci. Discoid meniscus, normal anatomical variants in which the normal open configuration of the menisci is absent, predisposing to tears. MRI criteria of it: identification of body of menisci on more than 3 continuous sagittal 4 mm slice, lack of rapid tapering from periphery to the free edge of meniscus, abnormally wide meniscal body on the coronal image. And this is coronal image, fast separation demonstrated it, lack of the tapering of meniscoid body. And this is on T1, also demonstrated large meniscal body. The meniscal body is seen on the different slides. Muscular anatomy. The muscular anatomy, the posterior and anterior compartment and the patellofemoral joints, this consists the posterior compartment from the adductor magnus tendon, sartorius muscle, gracilis tendon, and semitendinosus tendon, and biceps muscle. And the anterior group compartment consists of the quadriceps muscle. And at the upper part of tibia consists the posterior compartment from medial head of the gastrocnemius, lateral head of the gastrocnemius, and soleus, popliteus, and plantaris, and the anterior from tibialis anterior, extensor hallucis, and extensor deuterorum. This is diagram showing the muscle attachment, which is best assessed at the axial section. This is the upper end of the femur, at the distal end of the femur. This is the quadriceps tendon. This is the vastus medialis, and this is the vastus lateralis. This is the sartorius, gracilis tendon, semimembranous muscle, and semitendinosus tendon. And this is the long and short head of biceps femoris. This is the popliteal vessel. This is the section at the patellofemoral joint. This is the patella, and this is the lateral condyle of femur, and this is the medial. This is the vastus medialis, and this is the vastus lateralis tendon. This is the lateral retinacular ligament started to appear. This is the sartorius muscle. This is the gracilis tendon, and this is the semimembranous muscle, and this is the semitendinosus tendon. And this is the long and short head of biceps. This is at the upper end of the tibia. This is now started to appear the patellar ligament, and here the lateral, the medial head of the gastrocnemius, and this is the lateral head of the gastrocnemius, and this is the popliteus muscle. And this is the iliotibial tract, which is the component of lateral collateral ligament. This is axial image for demonstration of the muscle. This is at the distal end of the femur above the patella. This is the rectus femoris muscle, vastus lateralis, vastus intermedius, and vastus medialis. This is the semimembranous muscle, sartorius muscle. This is the gracilis muscle. This is the semimembranous muscle. This is the long and short head of biceps femoris muscle. This is here at the patellofemoral joint. This is the patella, and this is the femur. This is the patellar ligament started to appear. This is the vastus medialis, vastus lateralis, sartorius muscle, gracilis tendon, semimembranous muscle, and semitendinosus tendon. And this is the biceps femoris. This is the popliteal vessel. This is at the upper end of the tibia. This is the medial head of the gastrocnemius, and this is the lateral head of the gastrocnemius, and this is the popliteus muscle. Knee bursae. Sac surrounding the knee joint filled with synovial fluid, help to reduce friction over the tendon and bones. This is the suprapatellar bursae. And this is the suprapatellar bursae between the quadriceps tendon and femur, and this is the prepatellar between the patella and the skin, and this is the infrapatellar bursae between the patellar tendon and tibia. Fat pad. The bone of the joint surrounded by the fat pad, the suprafat pad, and infrafat pad. The suprafat pad, which is divided by suprapatellar bursae to the suprapatellar quadriceps fat pad and the prefemoral fat pad, and the infrapatellar fat pad between the patellar tendon and the articular bone, pad of Huff's fat pad. And this is lateral X-ray and lateral T1 and sagittal MRI demonstrated the suprapatellar fat pad, and this is the suprapatellar bursae, and this is the prefemoral fat pad, and this is the quadriceps fat pad, and this is the infrapatellar fat pad, and this is also the bursae. This is the suprapatellar, and this is the prefemoral fat pad, and this is the infrapatellar fat pad. Blood supply and innervation. Blood supply anastomosis around the knee joint between the branch of femoral popliteal vessel genicular anastomosis. Innervation, genicular branch of the femoral obturator tibial and camera-peroneal nerve. Movement, flexion by hamstring sartorius gracilis popliteus, extension by quadriceps femoris, external rotation of the flexed knee, biceps femoris and sartorius, internal rotation of the flexed knee by semimembranous, semitendinosus, and gracilis. Radiological examination of the knee joint. A plain radiograph of the knee joint, ultrasound, arthrography of the knee joint, magnetic resonance imaging, and computed tomography. Plain radiograph of the knee joint. Routine imaging, AB, lateral semiflex 20 to 3 degree, tunnel and skyline view. The joint space of femorotibial compartment and patellofemoral compartment should be ranged between 3 to 8 mm. The subcutaneous and infrapatellar fat, Hoff's fat pad outline some of the soft tissue around the joint. The ligamentum patelli made visible by this way. This is the anterior-posterior imaging. This is the patella, the medial condyle, lateral condyle, medial tibial plateau, and lateral tibial plateau, intercondylar eminence, and fibula. And this is the lateral image, which is best demonstrated the fat pad, the quadriceps muscle and tendon, suprapatellar fat pad, infrapatellar fat pad, patellofemoral joint, and tibiofemoral joint, medial tibiofemoral joint. The skyline view, which is the best view for demonstration of the patella in the trauma to exclude the fracture or dislocation. This is the lateral articular surface, and this is the medial articular surface, and this is the trochlear group on the femur. Tunnel view, axial intercondylar view, which is the best view for demonstration of loose body and assessment of the intercondylar eminence. Rule of ultrasound, it is essentially used for the external structure of the knee. It is a valuable diagnostic tool in the assessing of muscular, tendinous, and ligamentous damage. Classification of mass as solid and cystic. Guidance of injection, aspiration, and biopsy. This is the suprapatellongitudinal examination, demonstrated the femur, patella, skin subcutaneous fat with quadriceps tendon, half suprapatellar fat, and suprapatellar bursa. And this is the axial examination, demonstrated the rectus, the skin subcutaneous fat, rectus femoris, vastus medialis, lateralis, and vastus intermedius. This is infrapatellar examination. This is the longitudinal, demonstrated the patella, tibia, hyphus fat pad, patellar tendon, and subcutaneous area. And this is on the medial aspect, demonstrated the skin, subcutaneous fat, medial collateral ligament, the medial condyle of femur, and medial condyle of medial tibial plateau and medial menisci. And this is on the lateral aspect, demonstrated the skin, subcutaneous fat, the lateral collateral ligament, the femur, and the lateral tibial plateau and lateral menisci. Arthrography of the knee joint allow visualization of synovial cavity of the joint and some or all of the associated bursae, with that may be connected with the joint cavity. The menisci, seen as filling defect, triangular in cross section, whose upper and lower surface are outlined by contrast. Their base are attached to the capsule. Some contrast may be passed to the lateral menisci, which is less firmly attached to the capsule. This is the way for the injection. Double contrast knee arthrography, and this is the image. Knee MRI is one of the more frequent examination faced in daily radiological practice. The field of view is 10 to 14 cm, and the dedicated knee coil is mandatory. With the position of the patient supine with leg in full extension, the knee is placed in 10 to 50 degree of external rotation, especially for sagittal view. The slice thickness is 3 to 4 mm. Items to be evaluated on the sagittal, the menisci, medial and lateral, cruciate ligament, anterior and posterior cruciate, and tendon, quadriceps, patellar, bone synovial effusion. On the axial image, the retinicular ligament. On the coronal image, the collateral ligament. As this different axial image, different axial image from the upper end of distal upper tibia, the patella, and this is the patellofemoral joint. This is the upper tibial plateau, and this is the upper tibia, tibial condyle, and this is the proximal fibular tibial joint. And this is also a coronal image. From the anterolateral to posterior medial. This is from the anterolateral. This is the hamstring muscle. This is the started here to appear intercondylar notch with posterior cruciate ligament, and this is the posterior. This is intercondylar notch anteriorly with anterior cruciate ligament, and this is the root attachment of medial menisci, and this is the patella. This is a sagittal image from medial to lateral. Here started by medial condyle appear by it is menisci, posterior horn larger than the anterior horn and closely attached to the medial collateral ligament. And here the posterior cruciate ligament, which is attached to medial condyle, and this is anterior cruciate ligament attached to the lateral condyle, and this is the anterior and posterior horn of lateral menisci, and this is the body of lateral menisci. Knee CT scan. The purpose of knee CT scan is the depiction of the bony structure and morphology. Furthermore, the demonstration and the classification of fracture, as well as the visualization of bony tunnels and implant in post-operative setting. In the case of a neoplastic inflammatory infectious disorder, a knee CT is done to demonstrate the bony erosion, osteolytic lesion, classification, and to evaluate the bone matrix or soft tissue gas and their extent. This is the coronal tibio-femoral joint, and this is the axial image of the patellofemoral joint. This is a 3D reconstruction CT scan demonstrated the anterior aspect of the knee joint and posterior aspect of the knee joint. This is the patella, this is the lateral condyle, medial condyle, lateral tibial plateau, intercondylar eminence, and medial tibial plateau, and this is the head of fibula. And this is the posterior aspect. This is the lateral condyle, medial condyle with intercondylar notch of femur. This is the lateral tibial plateau, medial tibial plateau, and fibula with intercondylar eminence. And thank you for listening and attention.
أستاذ محمد عندنا مجال. يلا جازان. دكتورة جازان.
نعم أستاذ.
Number 1.
Lateral articular facet of patella.
Lateral articular. بس اشري عليها. إيه هاي lateral. إيه أوكي. نور بابا.
نعم أستاذ. Number 2 is the lateral retinaculum.
Of the patella. محمد مهدي. Number 3.
نعم أستاذ. iliotibial band.
iliotibial. أوكي. عقيل. دكتور عقيل موجود. خنساء.
نعم أستاذ. Number 4 biceps femoris muscle.
biceps femoris. نروح على دكتورة ليندا. Number 5.
lateral head of gastrocnemius muscle.
lateral head. Okay. Number 6 لارا نصير.
نعم أستاذ. popliteal vessels.
popliteal vessels. Okay. نور محمد أستاذ محمد كمل. أستاذ محمد.
أستاذ رعدي. نعم. محمد فرحان. Number 1.
نعم أستاذ. quadriceps tendon.
نور محمد جواد. Number 2.
نعم أستاذ.
posterior horn of lateral meniscus. عمر فهمي. Number 3.
نعم أستاذ. proximal tibiofibular joint.
شيماء علاء. Number 4.
neck of fibula.
زيد يوسف. Number 5.
نعم أستاذ. fat pad.
which fat pad هذا؟
هوفا fat pad.
اللي هو انتيريور أو انفرا باتيلر فات باد. عايشة. أكو بعد بنتي؟